Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. In a bid to curb the unrelentingly high number of COVID-19 cases within KL and Selangor, it was announced last Friday that there would be an acceleration of the vaccine rollout focused in the Klang Valley. Named Operation Surge Capacity, the rollout has the ambitious target of inoculating all adult residents in KL and Selangor with at least one dose of COVID-19 vaccine by the 1st of August. The operation will be managed by the federal level COVID-19 immunization task force, along with the Selangor State Government and the Federal Territories Ministry. Now, tasked to lead the coordination efforts for Selangor is Ong Kian Ming, DAP Member of Parliament for Bangi. He joins us on the show tonight. Kian Ming, good evening. Thank you so much for joining us. Now, can you explain what your role is as the Selangor coordinator for Operation Surge Capacity? I'm just wondering why there needs to be someone appointed now. I mean, was there a need for someone to coordinate between federal level and state level efforts? Was this a gap that needed to be filled?
Yeah, good evening, Melissa and Sharaad. Thanks for having me on this show. Always a pleasure to be with you guys and to get hard-hitting questions from you later on. So it's a very relevant question that you ask, and my specific responsibility is actually to coordinate the efforts of vaccinating industry. I was appointed by the Menteri Besar of Selangor to be on a committee to look after specifically many of the cases that were propping up that were related to the factories, factory workers specifically. This was about 3 weeks ago. And part of that responsibility involved having some level of coordination with my former ministry, the Ministry of International Trade and Industry. And I think because YB Khairi Jamaluddin wanted to ramp up the vaccination process in the Greater Klang Valley area, next week, as part of this Operation Surge Capacity, the fact that I could represent the Selangor State Government, having been appointed by the MB, and also have dealings with the Federal Ministry, MITI, as well as the CITF, the COVID Immunization Task Force led by YB Khairi Jamaluddin. I think that's sort of like the where the nexus meets, so to speak.
Yeah. Kian Ming, what is the epidemiological basis for this Operation Surge Capacity, when we know that at least the earlier enunciated principles around how to roll out the vaccines really was about targeting the most vulnerable first, and so on and so forth. We all know that logic. What is different in understanding the rationale behind this particular move?
Yeah, so I think the logic is quite simple when you look at the numbers. When you look at the fact that the Klang Valley contributes half or slightly more than half of the new cases over the past, I think 3 or 4 weeks, and the fact that the Klang Valley also contributes more than half of the deaths. This is something that's quite serious. The number of people that are brought in dead and also the people who are dying are actually in their younger category, those who are below 50, below 40, and they are mostly non-vaccinated, people who have comorbidities, maybe those who have been vaccinated only once. And I think YB Khairi saw the sort of like writing on the wall, and the only way in which we could address not just issues in the Klang Valley, but in terms of opening up the rest of the economy, the only way to go was to have this operation. And I think what is important to remember is that if and when this operation is successful, not only will we reach about at least 80 to 90% of the adult population in the Klang Valley having one dose, but because of this operation, we will also probably reach about 35 to 40% fully vaccinated adults in the Klang Valley. So with that, we will hopefully see a reduction in the number of serious cases, number of deaths. ICU capacity will be freed up, and that would also decrease the overall pressure on the healthcare system.
Okay, all right. I mean, that headline figure, that goal, that the objective that every adult resident within KL and Selangor will be vaccinated with at least one dose, that seems to be an eye-catching headline. But I'm just wondering, I mean, I may be skeptical here, but I'm just wondering whether, that there are trade-offs to that. What is the catch here? is it possible to vaccinate all adults within the Greater Klang Valley within a week?
Actually, it is. It would require some coordination, which is why I think I was brought into the picture. Of course, it's a team effort. It's led by the minister and also the many different agencies at the federal and state level that are involved. And I think the numbers are ambitious but doable. So, to give you an example, we just had a coordination meeting at about 4:00 today, and the ambition is to ramp up daily capacity in the Klang Valley from about 200 to 210,000 right now, today, to about 280 to 300,000 in starting next Monday. So that's about an increase of maybe about 30 to 40% capacity. It's doable because we're going to open up a number of specific PPVs that are catering to the industry. I was also suggesting to the committee that we should consider opening up some of the PPVs for more than 12 hours, perhaps even 24 hours, to cater for the factory workers who may have to work during the day, and they would be able to come out in the evening to get vaccinated at some of these big PPVs. So I think it's part and parcel of a larger team effort. We still need to have a coordination meeting, because I think what many people may not realize, when you talk about industry vaccination, right, there's also CellVax. That's an initiative under the Selangor state government that's going on as well, to vaccinate industry. The capacity is about 35,000 doses a day. MITI also hopes to have about between 25 to 30,000 doses. And then there's also other initiatives that are going on. The retail sector, for example, under the Ministry of Domestic Trade and Consumer Affairs, they have opened up a couple of PVVs in specific shopping malls to cater for the workers in the shopping malls. The construction sector also has...
How many different tracks are there currently running? Because you mentioned CellVax, there's Pikas, there's the shopping malls.
Retail,
how many are concurrently
there's
running?
Construction. I think there are more than 5, which is why we need a coordination meeting at the technical level tomorrow. That will be chaired by the KSU of MOSTI. So yeah, it's really a lot of moving parts. But I think in the end, everything would work out because when we have more initiatives going on at the same time in the Klang Valley, representing a population of at least 8 million people. I think 8 million adults. Sorry. We would have that kind of ambitious target to reach, involving different initiatives.
Kian Ming, why are there 5 different tracks? What are the differentiators between these tracks?
Okay, I'm not trying to speak on behalf of the federal government on all these different tracks, because they are all initiatives run by various ministries. So, for example, this is what I know from reading up and following the news on this. The Ministry of Works, for example, they have a separate track on construction workers, right? The Ministry of Agriculture, they have certain initiatives to vaccinate agriculture workers. The retail sector, they've already signed up many of the shopping malls to be able to vaccinate their workers, right? So I think it was a proactive stance by the various ministries. Ministry of Transport also has one for port workers, for example. So it's an initiative by the various ministries to make sure that their stakeholders are taken care of. I don't see anything wrong with that. It's just, we need to have better and proper coordination at the federal level and the state levels, especially in the Klang Valley, to make this process as smooth as possible.
Yeah, Kian Ming, it seems perfectly logical, from my perspective at least, for the different stakeholders. They might actually know their constituents best and the particular needs they have. But I do want to ask you this, that all this is in some ways dependent on data and full data about who we have in the Klang Valley. And I note that the word resident is used rather than citizen, and therefore, migrant workers who number in the millions. And then, of course, the question of the undocumented. How do you make sure that you get undocumented workers on the program when they are precisely not within your database?
So for MySejahtera, MySejahtera doesn't distinguish between documented or undocumented workers. So undocumented workers or migrants, they can be a part of parcel of the MySejahtera database. They can they can sign up for vaccination, and many of them have. I think the challenge with the undocumented migrants is that many of them are afraid that if they go to the PPVs, they may be caught by the authorities along the way during the journey, or some of them may get caught when they go through the process of checking in at the PPV. So I think the minister has made it quite clear. He's given the instruction that nobody should be arrested at these PPVs. There have been some sporadic reports of perhaps some arrests here and there, but I think by and large, this has not happened at the PPVs. But you're absolutely right in the sense that the data is something that's quite challenging, because I'm not sure whether you are aware, we've not had our census done in about 11 years. Right, the previous census was supposed to have been completed in 2020, right? Obviously that couldn't take place. In fact, the head of the Census Bureau, or the DOSM as we know it, Department of Statistics Malaysia, Dr. Uze, he was pushing very hard for the census to be completed this year. But yeah, because of MCO 1, 2, 3, that couldn't be done. So there's still some data gaps. We're trying to plug them. And just to give you an example, right? I go out to give these bakul makanan or these food baskets, and I mix it up when I go to my constituency. Sometimes I will give the official bakul makanan that's provided by the ministry, by the Prime Minister's department through the ICU, where we're given this 300,000 allocation. But at the same time, because I've been given a lot of donations and also rice and things like that, I go to some of these PPR housing, low cost housing, and I give out fresh fish, fresh chicken, frozen fish, frozen chicken. And some of these places, they are basically those people who come down, more than 50% are undocumented migrants from Rohingya, from Indonesia. And when I ask them, have you registered, have you gotten your appointment? I would say a large majority of them have not registered for MySejahtera and probably don't intend to get vaccinated anytime soon. So we need a different strategy. And I think that strategy will be discussed probably after the 1st of August, when we hopefully can reach the target that was announced by the minister.
And what impediments do you see to reaching that target, Kian Ming? I mean, this is, as you said, an ambitious target. And if and when you reach that target, what is stopping you from reaching it? What would be the challenges?
I think we would be able to reach the official target, meaning all those who are registered via MySejahtera, will get, their first appointment done, next week. Of course, not everyone will be able to show up for various reasons. There will be some leakages here and there. They miss their appointment. Some of them may be COVID positive. Hello, can you hear me?
Yes.
Can you hear me?
We can.
Yeah. Okay. Yeah.
Yes, we can.
Some of them may be COVID positive and have to skip their vaccination appointment. So that's why the minister has announced after the 1st of August there will be a walk-in policy for all of those who haven't gotten their first appointment yet in the Klang Valley. It is not walk-in at all of the PPVs. I think they will announce later which are the PPVs that will be selected for this walk-in process. So yeah, I think we will be able to reach that target after the 1st of August. The challenge then will be, as what the minister has said, mopping up the rest of the people who haven't gotten their appointments for the first vaccination or haven't registered, with MySejahtera, or even those who have registered, have MySejahtera accounts, but for different reasons they have chosen not to register for the vaccine. Whether it's vaccine hesitancy or other kinds of reasons why they have not registered.
Okay, we're going to take a quick break here and consider this, but more on how to manage this pandemic in just a few minutes. Stay tuned to consider this.
Sukar untuk COVID menjangkit kita.
2 minggu ini duduk di rumah. Kalau kita boleh laksanakan PKP Kendiri dan keluarga,
Saya kira insya-Allah kita boleh berjaya. Akhirnya kita menang.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop the spread of COVID-19. Social distancing, face masks, follow these steps, this SOP with the utmost discipline. Together, we can flatten the curve.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI sekarang.
Semua yang terjadi adalah berita, tetapi tiada siapa yang boleh bawakan yang terkini dan tergempar seperti kami.
Dilihat hanya memberi wang tanpa matlamat yang tepat. Dia tidak melakukan apa-apa kesalahan.
Untuk mendapatkan jawapan yang bermakna, kita perlu soalan yang tepat.
Amat sedih dengan apa yang berlaku kat atas.
Tiada ruang untuk berita palsu.
Negara kita telah merekodkan kes harian baru sebanyak
hanya fakta. Palsu.
Negara kita telah merekodkan
Hi, thanks so much for staying with Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. We're continuing our conversation with Ong Kian Ming, who has recently been tasked to lead coordination efforts for Operation Surge Capacity. Sharaad, hi, thanks so much for staying with Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. We're continuing our conversation with Ong Kian Ming, who has recently been tasked to lead coordination efforts for Operation Surge Capacity.
We understand, especially with the Delta variant, that it's really 2 doses that has a significant, impact in terms of covering people or being effective against severe cases of the disease. So how does it work then? I mean, what is the thinking about achieving that double dose critical mass that will have, in fact, an impact on health outcomes, rather?
Yeah, so as I was saying earlier, what we have to remember is that when the allocation for the first dose is made by CITF, what this means is also a commitment to have the dosage for the second dose be allocated 3 weeks later for most of the vaccines that are going to be used, which is Sinovac as well as Pfizer, right? AZ has a lag of about 9 weeks. So what in effect will happen in the Klang Valley is that we will see, like I said, over 90% of the adult population vaccinated with the first dose. Second dose will probably be about 35 to 40%. And then within 3 weeks, you'll have, probably 80% up to 90% vaccinated with the second dose. So by Merdeka time, the whole of the Klang Valley almost, including, walk-in starting on the 1st of August, will be fully vaccinated. Right, so I think that's very, very clear, very, very strong and compelling to, move so that we can open up at least half of the country's economy, fully open up, not fully open up, but open up significantly, depending on, the SOPs and the, announcements that will be, announced by the government through this National Security Council.
Does the Klang Valley Operation Surge Capacity, does that take away from other states' supply? Does it push them back in terms of order of supply?
I think it may, because, there has got to be some reallocation exercises. But I think what is important is after this Operation Surge Capacity in the Klang Valley is done, I think whatever that we learn from this process, some of the adjustments that we make along the way could be used in other operations that may be carried out in other states. I think this is something that the minister would announce as and when he has evaluated the landscape. So it's not necessarily a bad thing if let's say it's a short-term surge that will help, more than half of the country's economy. You're talking about Klang Valley resident population of more than 10 million. And then hopefully be able to help other places as well. So there are quite a lot of, numbers in terms of COVID cases in places like Negeri Sembilan, Johor is next, Penang, and of course, hopefully this can be done in a more strategic way in a place like Sabah, where the number of vaccinations is still relatively low, and I think that has got to do with a lot of capacity issues as well. I have been fortunate enough.
Sorry, Kim, if I can interrupt you. I don't know if we have learned enough about the way Malaysia actually operates. I know we think in terms of states because of federalism. We think that everything needs to be organized along those administrative lines. But people don't live their lives necessarily according to these administrative boundaries. And the Klang Valley has satellites. Say Seremban is a major satellite city of the Klang Valley, and so on and so forth. And so if we're going to, truly open up and liberate the economic sector, won't it have to take into account that reality, that people aren't, and strategies can't just work on this state-by-state basis?
Yeah, sure. I think the Seremban, the Negeri Sembilan example is a good one. I think the number of doses that have been allocated in Negeri Sembilan, I've seen the stats, is quite sufficient. I think the challenge in Negeri Sembilan is, unlike Klang Valley, right, where you have a lot of venues, big venues, where you can have these mega PPVs or big PPVs. The amount of venues in Negeri Sembilan is relatively limited, right? So I think they do have some capacity constraints. I was told that until recently, they were not operating on weekends. Saturday and Sunday, they didn't have the big PPVs in operation. So it was only with some recent changes in Negeri Sembilan that the vaccine rate could be ramped up. And I'm quite confident that after this Klang Valley surge is done, other states like Negeri Sembilan and Johor also would be able to benefit from the extra allocation of vaccines that I'm sure the minister would announce in a necessary time.
Right. If I may take a slight pivot from the conversation, I mean, the bipartisan approach for Operation Surge Capacity, critics have said, while welcomed, it's too little too late. And I'm just wondering, given that we have Parliament reconvening on Monday, can we expect to see the same bipartisanship when Parliament reconvenes?
I hope so, but I think for Parliament, I'm a little bit less optimistic. I'm probably more optimistic with regards to the help that I can provide, or the assistance I can provide in my own small way to YB Khairi in this particular effort. I think it's also because we've built up trust and cooperation informally over the past couple of months. I've shared with him some of my experiences and challenges in opening up new PPVs, even in my own area. He's also helped me, assist me in terms of providing me guidance in terms of some of the information and contacts. So, I think we need this kind of a spirit of bipartisanship at all levels of government and all ministries. And, sadly, I think there's been other obstacles that have been put in the way. And I think the political environment now probably is a little bit too toxic for these kinds of more substantive bipartisanship efforts to take place.
Kian Ming, what is the timeline for the opening up, and when do you think the dividends from this strategy will start to pay off?
I think the National Security Council will be meeting tomorrow, and there's been hints of what may come after that. So today, the Deputy Prime Minister Ismail Sabri already said that likely that those factories who have their workers, at least 80% of their workers fully vaccinated, they would be able to be allowed to open up. And I think this is good because it takes away the false distinction between essential and non-essential services, in terms of the manufacturing sector. The Prime Minister, has hinted before that, interstate traveling privileges may be given to those who have been vaccinated twice. So I think the gradual reopening of the economy is, going in tandem with the vaccination rate, which is why I think it's important to focus on the Klang Valley in the next week or so.
Right, and I wanted to talk about that, about reopening the economy. I mean, you made a presentation, we understand, on possible reopening of the economy, but based on science and data, and you say besides just opening up more sectors, there are other quote-unquote costless ways that we can increase economic activity. Can you just walk us through some of your proposals?
Yeah, so I think one, I made an offer to give pro bono consulting services based on my experience as a management consultant with the Boston Consulting Group more than 20 years ago. I thought I'll, brush out my consulting skills and give it pro bono to the SMEs. And one of the SMEs I encountered was a property consultant or property manager who has a lot of these properties on the second and third floor of these shop lots, commercial shop lots that couldn't be rented out because of this COVID economy. And he wanted to convert them into temporary housing and accommodation for workers, including foreign workers in the manufacturing or retail sector or the service sector. And right now, that's not allowed because that has not been recognized by the local authority. But the Ministry of Housing and Local Government released a circular in March detailing some of the processes and procedures that local governments could use to allow for this temporary accommodation quarters to be recognized. And this is an effort that I'm trying to do in my own small way in Selangor. So that some of these businesses can be helped. And you think about it, it's a win-win situation. You get proper and better housing for a lot of these workers, and then at the same time, you would allow these businesses, these property managers, these shop owners to be able to collect rental and to pay, their installments on the property that they've bought. So win-win. The Ministry of Finance doesn't have to come up with any money. The state government doesn't have to come up with any money. In fact, they probably gain some from licensing fees that these shop owners will pay.
Kian Ming, it seems that in many parts of the world, the pandemic is an opportunity to rethink, reset, and do things differently, build back better. These are the mantras of the age. But is bureaucratic inertia, a lack of imagination, or just a pure stubbornness, holding us back in Malaysia?
I think it's more of a lack of imagination, or perhaps not having seen or thought of new ideas. So, for example, one of the things that I suggested when I was speaking to the Minister of Finance and presenting some of my viewpoints on the National Recovery Plan is, to think out of the box and involve different ministries in the effort to build back better. So, for example, why not involve the Ministry of Tourism and also the Ministry of Youth and Sports to create a sports bubble whereby you could have a international triathlon event that could be hosted in a place like Langkawi, and bring international competitors in here through KLIA. That bubble, will get them from KLIA to Langkawi without them having to sort of like mix around with the local population, so to speak, in KL and Selangor. And then you could benefit the tourism industry by populating hotels. At the same time, you could help sports events or outdoor events organizers as well, because they would have the ability to organize outdoor events, sporting events that they've not been able to do for the past 1.5 years. Right. So this is just one example. I'm sure that there are many other examples that smarter people and more creative people like me can think of. Yeah.
Kian Ming, thank you for sharing those with us tonight. That was our conversation with Bangi MP Ong Kian Ming, recently appointed as Selangor's coordinator for Operation Surge Capacity. And that wraps up this episode of Consider This. But before we leave you tonight, don't forget that you can get all the latest news on COVID-19 vaccines from astroawani.com as well as the Astro AWANI app. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching. Good night.